You have reached the public service. Ask yourself one question. Are you a taker or a maker? As with any situation in life, is your situation taking or making you happy? Hello, my name is Sandra.
And I'm Kirk.
And this is a public service show.
Hello.
Today, we're going to talk about healthcare versus wealthcare.
Yay.
And what happens from the moment you're pregnant till death. Since we're having issues with our healthcare and dropping the ACA in our country, we're going to give you some hard numbers on what it's actually might cost if you were to try to purchase insurance today.
Yeah, I mean, these are all ballpark. These are numbers that we got, but they could be more.
These are the current numbers in our country, but since the ACA has been abolished, these numbers mean nothing.
The big, beautiful bill.
The big, beautiful
bill.
The
beautiful bill. The one that they've been fighting now, and they recessed them through the holidays because they didn't want them to vote on and all this other stuff. Yeah. Big, beautiful bill.
So currently, pregnancy, to get pregnant with your prenatal care and all of those things, on average costs about $18,865. And that's if you're in a large group like United Healthcare or something like that. That's kind of low. So, but what happens if baby doesn't want to come out and you need a C-section? Average in this country is approximately $17,000 or more just to be wheeled into the emergency to a room and have the baby cut out.
In addition to the $18,000.
That's exactly
almost
right.
Almost $19,000 that you were talking about.
So you're close to $40K, and that's with health care.
And Epstein files are so unhappy with themselves, they just threw themselves right off the wall.
Now, this doesn't include your copay, and it doesn't say exactly how much your insurance will cover. You may have to pay even more than that. That's the average costs. But because there's no truism in pricing, we can go to any hospital and their price will be it'll be hugely different because they don't disclose how much they charge you per item. You can go in and get a Q-tip at one hospital, it'll be $100, and $200 in another. And I'm just using a Q-tip but that's exactly how the pricing is that they don't disclose anything and you have to fight for your money later on.
Yeah, not regulated.
There's a lot of hidden costs.
Yeah.
Hidden. Or say, for instance, you had a broken leg or something like that, right? And they called in a specialist. The specialist could sit on his phone at home and say, yeah, it's broken. There's another $7,000 to the bill. He looked at an x-ray for 5 seconds, goes, yep, it's broken. That's the hidden costs. Or he might not have. It might have been somebody else that read it, but his name is on it, so that's another $7,000 or $20,000 in costs.
It's just, I had an epiphany there for a second, but we'll get into that another time. But the cost it's ridiculous.
That's right.
As Sandra's telling you, the cost of what you'll pay. In this particular case, using an example of pregnancy, and it's important to note out pregnancy because clearly enough babies aren't being born in this country that they had to take out, Roe v. Wade. And so, anyways, yeah, you can draw your own inference there. But, that's what it costs. But now, okay, where are you at with your insurance, right? I mean, you're looking at being out of pocket, copays, around $9,000 if you're a single person, which, I don't know if anybody has $9,200 laying around in their bank account just to be thrown down the tubes, but that's kind of where you're at, and
or
it
more.
can go higher or more.
Like I said, if there's hidden costs.
Yeah.
So what your friend might have paid for their baby at hospital somewhere else might not even be close to what you're charged at hospital B.
Yeah.
So that's why we're giving you an average cost, because the research that I saw you could be charged to the moon.
Yeah.
Depending on how much money the hospital needs to pay whoever.
Yeah. And nothing is grandfathered or grandmothered in
your health plan. That's
in your
right.
plan. Your plan can go as high as they want to take it, and there's really no protection. And the ACA, the ACA is Obamacare. And did you know that Obamacare is the ACA? So, with the big beautiful bill taking funding out of the ACA and this whole nightmare that's going on, the ACA was the only or one of the main regulators of this. So, what was barely regulated is even less regulated now. And you're at the whim of these insurance companies. And
no, you are 100% correct.
How it's all put together. I mean, the amount of money you could pay for something simple is astronomical.
That's exactly right. The ACA was responsible for holding down prescription drug costs. The ACA was responsible for getting as many people as they possibly could to sign up for health care, which drove down the prices. Because the more people that were in the pools, the less they would charge for things, because it was easier for the majority to drive down prices than a minority to drive down prices, because they could negotiate your costs because there were so many of us in the pools. Mm-hmm. That's at least the way that I understood it worked. Now that at least 45 or 50 million people or more no longer qualify for health care, the prices are going to skyrocket because these hospitals have to pay for themselves. All these emergency rooms are going to be full. This is what I understand. So it's going to be quite devastating for folks, most families.
And when you go to the grocery store, there's the bulk section. This is the same principle. The more people, the lower the costs for everybody.
Because they're buying more.
And with this big beautiful bill and all of these people being taken off, the numbers of 40 some odd million people, that's a very large bulk removal, and it's going to impact everybody. I mean, I know you keep hearing it on the news that folks who have employer-based health care are going to get impacted, because at the end of the day, the part that no one can control is the health care costs that the hospital and these doctors and these different medical buildings throw on you. And the number of people going down using their services, the bulk is reducing. They're going to crank their services, and if you use insurance and you get sick, you're going to be stuck dealing with it.
That's exactly right. But it's not just that. He's correct about that. But the emergency room uptake because of this. Because if you don't have insurance, most of the people just wait until they're very sick. And then they go to the emergency rooms. And the emergency rooms are going to see a huge uptake in people coming in, because they're not even going to be able to afford prescription drugs anymore. Once the cap was taken off of the ACA, your insulin, the things that you need, your high blood pressure medication, all of that is going to cost a lot more. And we have to figure out a way that we can drive those costs back down. But right now, since everything is out of control, I'm not sure how this is going to work. But even if you were to have a child, and now with the ACA gone, it used to be the average cost to add a single child to your health care was $475 a month. That money covers your shots, not the copay, but the shots and anything else that the child needs. And forbid that something bad were to happen, of course, you're going to have to pay quite a bit. And adult health care right now through employers average is about $465, but that is expected to go up. I have no idea, but I know it's going to be huge. I don't want to speculate, but I'm just afraid to say it.
I want to go back once to back to the child board.
Sure.
How much was the president saying you were going to get as a one-time? We're going to give you a one-time.
He's going to give you, was it $1,000?
I think it started at $500, and then somewhere along the way it might have got increased to $1,000. So basically, that one-time gift from the federal government.
Don't quote me on that. I thought it was
wiping out your health care.
We'll pay 2 months of your child, your HMO or PPO.
It's not even going to cover it'll cover the shots. But once the shots are
not
done,
even, not the copay.
And you're just, so think about that for a second. The offered up choice solution by the current American government is we've wiped out the back end of it, the ACA.
Kicked everybody off,
and they wiped out, pregnancy protections, Roe v. Wade, all that good stuff. And
senior protections.
Then they turn around and they say, but, hey, because we've taken all of those different things away from you, we're going to give you a whopping grand one time. Now, not like this child has to eat every month for the next how many years or whatever. Or, have to be, in this case, healthcare. It's not like they don't have to be covered for the rest of their lives versus just being born.
and that's the whole thing, is the encouragement to have children. Okay. But you have to incur all the costs, However, since the ACA has been abolished, it seems, all health care across the board, and I understood the veterans are also in this group of people that have had their benefits cut.
Yes, we have.
All children, because they are getting rid of the protocols for shots and inoculations, which could be a real problem. And that would include all adults, us as well, and seniors.
Yes.
And seniors as well. So that means that everybody that was currently getting subsidies from the ACA will now find that when you're getting your bills, you notice that it's going to be doubled or tripled. That's why. Because they're not explaining to you how, I told you, those 45 plus million people who were kicked off the insurance ACA rolls were helping support the group of us. And we were too. We were all paying into this, which drove the prices down. Now, I have no idea. The sky's the limit for charges. I was reading some things, and these insurance companies and hospitals and, frankly, anybody that has their hands in healthcare plan to charge you as much as they can because they don't want to lose any profits, regardless of your health care.
Lose profits? Oh, well. Yeah, profits over people.
Over human life.
Over human life. We can go down the list on this. I mean, this is what really gets me going. Is while all of this is being bandied about in the courts and Oh, we have a vote in Congress and it didn't pass. Oh, we have a vote in Congress and it didn't pass. And eventually we'll probably be kicked to the Supreme Court. While all this is going on, how many people are dying because they don't have the care that they need? How many
we
people
had people
are
that didn't
suffering
have the care still, and we were
care?
trying to cover everybody.
And it's, where are those people, where are their families' restitution while people who are clearly not qualified and are completely clueless kick this around? I mean, and you people who are in the healthcare industry, I mean, are you okay with this? I mean, we know the CEOs, at least all the CEOs but the U.S. healthcare CEO is okay with this. I'm sure you all know that story. I just don't know what to say.
I'm at a point now where I am tired of people saying, let's not do anything socialized, right? And in Europe, everybody's covered in their country. Everybody gets health care, not dental, but they get health care. And they're a lot healthier than we are there.
Yeah.
Why? Because they don't have to worry about if they get sick and getting a bill for $100,000 and losing everything that they have. They don't have to worry about that. But here, I listen to people go on national television and say, I don't want to pay for somebody else's health care. And I'm like, but everybody else is paying for yours. And that part doesn't resonate with them. They don't understand that our pooling of the money is also supporting you. Now they're starting to understand what they're losing. And because they used President Obama's last name, they didn't want it. I've heard people go, I don't want Obamacare, but I want the ACA.
Yeah.
And I'm looking at them going, okay, so you don't want Obamacare, so get rid of the ACA. No, I go, those are synonymous. Those are the same thing. And just because they used his name because he authored it doesn't make it bad. Now we all have to suffer because people didn't want to be part of President Obama's legacy. Now they found out that his legacy was one of inclusiveness and helpfulness, and picking everybody up and saying, here's some health care. I'm applauding that because now I'm going to watch a lot of people die. You're already splitting your medicines because you can't afford your prescriptions. Just imagine now, and those were supplemented. No supplement. You're going to get a bill for $8,000, $9,000 for medication that you were only paying this amount for. This is the warning label, people. You need to wake up and you need to fight because most of the drugs that you're taking, we paid for. We paid for the research here in the United States. We paid for these people to go in these labs for years and make these drugs. We're the only we're the only nation that doesn't get these drugs for free or close to it. Everybody else does. The pharmaceutical companies say, thank you for helping us with the research. We're not going to give you the benefit of it. We're going to put these drugs out and we're going to charge you the maximum for it. And meanwhile, in Europe, the same drug that you're taking costs them $1.50. Here, $600-$700 more. That's another thing that I want to stop. I can go on a rant, but if you don't believe me, Google it. Look at your drugs. Look where they were manufactured. Look where they did the research. Here, out of our research dollars, we get no benefit from that. Sorry, tapping my nails again. Bad girl. I'm mad because we're punished.
My story about this single payer healthcare versus two different people I had this conversation with. Two different people, two different walks of life, from literally separate sides of the world, of the country. And we were talking about the single payer system and everybody having health care versus the employer paid. And I broke it down. This person, both people, let's just say you're paying $250 a month for your employer-covered health care. And you've got an HMO, you've got a PPO, or whatever it is you have. You have to go in-network, you have a copay, and the minute you crack that copay, your out-of-pocket expenses, you cap out, you don't have coverage, or you're out of pocket. Versus no $250 coming out of your check from your employer, but you'll get taxed an extra $250. So $250 is gone. It's either going to Blue Cross Blue Shield or it's in a tax to the federal government. And the single payer system, you can go anywhere in the country. You don't have to have, and this is what Canada, England, France, Spain,
that's right,
all of them, Cuba
anywhere
has.
Cuba.
You can go
Did
anywhere.
you wait? Stop there. Cuba. Oh, that should be a drops the mic moment when he said that.
Yeah, you know, third world.
Yeah,
country.
the one that we hated, but they're healthier than us. I'm sorry.
No.
Go right ahead.
So you could go anywhere in the country, any physician for anything from a toenail to advanced cancer medicine needs, and you don't pay a dime. Your $250, the one that you would pay regardless to a private healthcare company or, insurance company or to the federal government, that money's gone. That money's out of your wallet. The difference is now you can go anywhere. You can see anyone in any state, anywhere. That is single payer healthcare. And I broke that down for these two individuals. And you want to know what both of them told me? Both of them told me this. When I asked, so which one would you prefer? I'll pay my employer health care with the much worse coverage. And when I incredulously asked why, because I would have immediately assumed they'd have jumped on the, well, gee, I could go anywhere in the country and get anything that I need done. Their answer was literally identical. Well, I don't want my money paid for anybody else to have health care. Are you kidding me? These two does it get any more selfish than that? They're out $250. $250 is coming out of their check regardless. And their answer could have been anything from, well, we didn't want the government managing it because the government messes everything up, to, there's just a litany of things you could go down. They literally said, well, we don't want our money paying for somebody else to have health care.
Then you can purchase your own individual care and you can manage your own health. You get in trouble, right? You better come up with that $50,000 for that broken leg, because I don't want to pay for yours either.
That's right.
It goes two ways. However, when we look at the broken healthcare system we have, there are two problems with it. One, of course, he mentioned, there are people that don't care about other people, but those are the same people that scream the loudest when people don't care about them. So keep that in mind.
Oh, yeah.
Keep that in mind. But hospital costs, insurance costs, and prescription costs. Those are the three things that you have to deal with when you're sick or you need something. Hospital costs. Why do hospitals charge different amounts depending on the hospital? Why can't we have uniform pricing? I go to hospital A, should be the same for the Q-tip at hospital B. This is why people are struggling, right? Insurance costs. Why does one insurance company charge this much or only covers this much when this insurance company covers this much? We need uniform pricing with the insurance companies too. Just like I said with the prescription drugs, excuse me.
Or no insurance companies.
Let me say this. Yeah, that's what I'm saying. This is where we have to start because we don't have that. So if we had, and I'm going to say these words very loudly, consumer protection laws, the hospitals wouldn't be able to have different pricing. They'd make sure with consumer protection laws that across the country, everybody paid the same. With consumer protection laws, the insurance companies would not be able to say, you're going to pay more because we want more profits. You're going to pay less because we have more people in our group. It would be the same for all. That means that your costs would be lower. Then the prescriptions that we're paying a maximum for, and if we develop those drugs here with our money, we get for free for the first 30 or 40 years. Then after that, we still pay a minimum because we own those drugs. You may have developed them here, but you would not have been able to do the research had it not been for US dollars. So you can sell them to other countries, but you're not selling them to us. So once again, consumer protection laws that protect us as the consumer. What a novel idea. This angers me because a lot of times when I see the things that are happening to us Americans, it's because we don't have consumer protection laws. We have, ding, 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 lobbyists.
Yeah.
Lobbyists that go in there and say, don't protect the American people. Here's some money.
Yep.
Don't give them, cheaper prescription. Here's some money. Don't give them health care costs at a minimum. Here's some money. Well, I'm opposed to that. And I want consumer protection laws that say that no lobbyist can go in there and say a person has to die because somebody wants to make a profit. Unfair, unfair, unfair.
Well, now we're getting into the whole Citizens United dark money lobby unlimited campaign.
That's exactly right.
And all that's tied to consumer protection.
We've always had lobbyists. They were limited about what they could do. Now the floodgates are open. They own everybody. I'm not talking about any party. I'm talking about them all.
Everybody.
I'm talking about them all. We are struggling and supposedly the richest country in the world. We have the worst health care in the world. We have the worst consumer protection laws in the world. We need to start telling people that this is our money. This is our pooled resources, our pooled taxes, and we want it to work for us, not for the rich. Why am I paying an insurance company to treat me like crap? Why am I paying a hospital to treat me like crap? We need to roll that back. Think about it. Think about the words consumer protection and what you want that to mean as far as your life and how it will benefit your life. Yep.
I've got nothing to add. What she said.
What we said.
It's a mess, I mean, since the dawn of time, the wealthy people have been beaten on the little person, and they've invented all kinds of things, religion, class. I mean, you can just, we're not going to get into that. But we've reached a point in our existence where I'd like to think we're hopefully, at least a good chunk of us are enlightened enough to know that we're done being the butt of their joke.
Right.
And, it's funny how they live high in the hog because of us, yet they deign to even acknowledge our existence. And they spend their resources, instead of spending their resources on a new, education and medical centers and all these other different things that would benefit everyone, They'd rather blow their resources on tearing us down. And until we get, consumer protections covers a very wide swath of things.
Well, there used to be consumer protections where that your water,
right?
Remember, coal and fracking and stuff like that. You could never do that because it would affect the environment and people's drinking water. Now, let me repeat that. People's drinking water. There are plants out there that move to certain states because there's no regulations or consumer protections. And it's really funny how, and it isn't funny, I don't mean that word that way, that around that plant, there's like clusters of cancer. Mm-hmm. And they go, oh yeah, we know that we are putting cadmium-5 or something like that that's highly cancerous in your water and in your ground and stuff like that, but you don't have any consumer protection. So we can continue to do this, and you can try to sue us, but we have these amazing lawyers and the governors of these states that say, no. Let us buy your house back for, let's see, you paid $300,000. We'll give you $50,000. Get out. That's how that works when you don't have consumer protection. You can get on your Google and you can find cities in certain states that have the highest clusters of cancer. Then, when you find that city, find out what company's there. Because there's going to be a big factory right there in the middle of that town where these cancer clusters are. Then you can Google, well, what's the matter with the water? And then you'll start seeing. And why they allow that. You'll see that there's some very, very wealthy people. And like I told you when I started this show, that the one thing that I wanted to fight for, and there's a lot of things I want to fight for, but I want to fight for consumer protections. Because if we did like the two people that he was talking about and say, I don't want to pay for them, mm-hmm. I don't want to pay for the pharmaceutical companies, the insurance companies, the hospitals to treat us like crap or anybody else to treat us like crap. What if we decided to take our little bit of money, tax dollars, and say, no, just like that. I don't want to pay for this. How do you think these companies would react if we had the ability to do that? Yeah. Ooh, I bet they'd be scared.
And of course, full circle.
Yeah.
Without the consumer protections, healthcare is run rampant and people are sick because there are no consumer protections because the factory is poisoning their groundwater. But there's no healthcare because they've got control of that too and they're wiping that out. So,
where are we?
Yeah.
We're in a very, very dangerous cycle of abuse. And I'm using the word abuse because it is. Because hospitals wouldn't have money if it wasn't for yours. Insurance companies wouldn't have money if it wasn't for yours. Pharmaceutical companies wouldn't have money if it wasn't for your money. This is all our money.
You're tippy.
And I'm sorry, I just get so enraged.
I'm gonna get you one of those
this
little
is
soft
our
bumper.
This is our money. And we want our money to work for us. We want that money to come back and take care of us, not take care of people that don't care about us. And that's what's happening. They don't care about us.
That's probably the single most frustrating thing about this is all this originates with money.
Our
from
money.
The American people. We paid for all the innovation. We paid for all the progress. We paid for all of it.
Infrastructure, hospitals, everything. Don't look at that hospital as a separate entity. Every time somebody goes there, they're paying for that hospital. You need to flip the script on what you think. You're afraid because they're powerful? We made them. We built all of this, just like he said. We built it all.
Built it all.
And as soon as you start to change your ideology and start thinking about, everything that is out there was created and built by the American people as a whole, then you start to say, hey, wait a minute.
Yep.
You can't tell me I made you. your
Yes, we do.
power. Take your power back.
I think that's a good place to stop right there.
Aw.
Yeah, it's kind of like that AC/DC song. Who made who? We made
I don't know
who.
that song, but
Good tune. It's a opening to Maximum Overdrive, an Emilio Estevez movie with somebody else.
didn't see
In
it.
the 80s. Okay.
Sorry.
Yeah, that's a good place to end it, actually.
Okay. Well, hopefully we just giving you a little bit of fire, and some of you a lot of fire,
Yeah.
because we need to stick up, stand up, scream. It's that time. It's no more sitting in your kitchen on your computer. No, it's time. Scream. We're going to be really sick in this country if we don't.
Yeah, there's a 4-alarm fire going on
Oh,
right
yeah,
now.
yeah.
We've kind of not to make it sound like it, we've kind of gone past the time of talking.
Oh,
We
whoa.
need to start doing some action. And, whatever that action is, obviously we need to do action that's helpful for people, helpful for everybody, not destructive.
Right.
Or we don't want to hinder the process of improvement. This needs improvement. And it needs improvement now.
Now, because we don't want to wait. We don't want to wait until there's a million caskets out there,
Yeah.
like we did last time with COVID.
Yeah.
We don't want to wait until babies are dying and our elderly are dying. Everybody's dying because they can't afford it. This is why I'm screaming at you, hey, this is our money. Don't look at that hospital. I don't care what the name is on there. If you go there, that's your hospital. That pharmaceutical drug that you're taking that was made here, that's your drug, right? These insurance companies, that's your insurance company.
We have the
They
highest-
try to treat you like you have no power. Don't let them do that anymore. Take your power back. And we do have the highest
We have the highest infant mortality rate
mortality rate in the
in the whole world.
yeah.
In the industrialized world.
Yeah,
But
exactly right.
Considering what we have ascertained that most third world countries, and I hate that term. Third
I do
world.
too.
We all live in one world. There's no third world.
There's one
But-
world. He's right.
But we've ascertained that most of these countries have better health care than we do.
Yeah, they do.
So, yeah, I would be willing to bet that the United States probably has the highest infant mortality rate in the world.
We do. I believe we do.
Yeah, there you go.
We just,
Public
this
service.
is the Public Service Show. And I am Sandra.
And I'm Kirk.
And thank you for watching.
You have been watching a public service show. America is part of a global community. Sandra and I are well aware that the American experience had the hope for freedom. America isn't perfect by any means, and we are currently having our freedoms tested. Here at the Public Service Show, we're going to look at how and why we're at this point in America.